Thank you very much for asking me to talk about our successes over the last 2 years. We have brought some 30 organisations together across the North East and North Cumbria. This has included our acute trusts, our CCGs, our mental health trusts, our ambulance services and members of the public. Urgent and emergency care is an incredibly complex system and we need to intervene in many different areas in order to improve our performance. Our CCGs and our foundation trusts have worked very closely together on this initiative. We have a strategic network which is jointly chaired by me and by a foundation trust chief executive. We have an operational network that brings all of our A&E delivery boards together. We have a very strong clinical reference group led by some of our emergency care physicians, which again brings all of our clinicians together. It is important that we reduce variation and that we try and work in harmony across the North East and try and work together in order to solve some of our problems. We've run a number of initiatives. You have to begin with the population and to make sure that they make best use of the services that we have on offer. To do this, we have beefed up our 111 service. We have a clinical hub that will give clinical advice to people when they need it. We have done a bit of behavioural analysis to try and understand why people use the services they do, and this led to a very successful Plasticine People campaign that we ran over the winter. Once people move away from self-care and from accessing their GPs or from their pharmacies, we have worked with our paramedics so that they can do more see and treat and hear and treat to try and avoid people accessing hospital services. Once people turn up in hospital, we've done a lot of work with our foundation trust to help the flow of patients through the hospital system. Once people have finished with their acute care, we've also worked with our foundation trusts and with our social care partners to make sure that people can get home as soon as possible once they no longer have a medical need. Some of our other initiatives include Respond mental health training, training professionals, police, paramedics, what to do in a mental health crisis. We've developed an under 5 app for parents of children so that they know what to do when their children are ill. This app has been downloaded some 8,000 times and has been nominated for 2 national awards. We are also training care home staff in the National Early Warning System and in the prevention of falls. We have set up a flight deck which allows us to look at how busy all of our hospitals are in real time across the North East and allows our ambulance services to divert ambulances wherever necessary. We've improved our directory of services so that 111 can direct patients more appropriately. We've also allowed 111 direct access to our GP appointment systems so that patients can be booked directly in with their GP when that is appropriate. I'm very proud of what we've achieved over the last 2 years, but there is still a huge amount of work to do. Although the North East and North Cumbria perform well on urgent emergency care services compared to the rest of the country, we know that we can do much better. We know that by working together, by standardising what we do across the North East and North Cumbria, we can deliver real change working together in the future.